Boxer dog health issues, a guide to common conditions. Boxer dogs are beloved companions known for their energetic and playful nature. However, like any other breed, they are prone to certain health issues that owners should be aware of. This video serves as a guide to common health conditions that can affect boxer dogs, providing valuable information on their causes, symptoms, and effective management strategies. From genetic conditions to lifestyle-related problems, boxers can be susceptible to a range of health concerns. By understanding these potential issues, owners can take proactive measures to ensure the well-being of their furry friends. Genetic health conditions are one area of concern for boxer dogs. They are prone to conditions such as hip dysplasia and heart disease, which can significantly impact their overall health. By learning about the causes, symptoms, and available treatment options for these inherited conditions, owners can effectively manage and alleviate their boxers' discomfort. Another common issue faced by boxers is skin problems. Allergies, dermatitis, and infections can cause significant discomfort for these dogs. By exploring the common skin issues faced by boxer dogs, understanding their symptoms, and learning about preventive measures and treatment options, owners can ensure their boxers' skin health is well maintained. Gastrointestinal issues are also a concern for boxer dogs, as they are known to have sensitive stomachs. Conditions such as gastric dilatation volvulus, GDV, and food allergies can affect their digestive health. By understanding the causes, symptoms, and management strategies for these conditions, owners can ensure their boxers' well-being. Cancer is a significant concern for boxer dogs, with certain types being more prevalent in this breed. By exploring the common types of cancer seen in boxers, their symptoms, available treatment options, and strategies for early detection, owners can take proactive steps to address this serious health issue. Joint and bone issues, such as hip dysplasia and arthritis, can also affect boxers. By understanding the causes, symptoms, and management strategies for these conditions, owners can ensure their boxers' mobility and overall quality of life. Boxers are also prone to certain eye conditions and dental problems. By learning about the signs, treatment options, and preventive measures for these issues, owners can maintain their boxers' visual health and oral hygiene. In conclusion, this comprehensive guide provides valuable insights into the common health issues that boxer dogs may face. By understanding these conditions and implementing effective management strategies, owners can ensure the well-being and longevity of their beloved boxer companions. 1. Genetic health conditions. Boxers are prone to certain genetic health conditions that can impact their overall well-being. These conditions include hip dysplasia and heart disease. Understanding the causes, symptoms, and available treatment options for these inherited conditions is crucial for ensuring the health and happiness of your boxer. Hip dysplasia. Hip dysplasia is a common genetic condition in boxers. It occurs when the hip joint develops abnormally, leading to discomfort, pain, and difficulty in movement. The causes of hip dysplasia can be both genetic and environmental factors. Some of the symptoms of hip dysplasia in boxers include lameness, difficulty in getting up or lying down, reluctance to climb stairs, and a bunny-hopping gait. If you notice any of these signs, it is important to consult with your veterinarian for a proper diagnosis. Treatment options for hip dysplasia in boxers may include medications for pain management, weight management to reduce stress on the joints, physical therapy, and in severe cases, surgical intervention. Your veterinarian can guide you on the best course of action based on the severity of your boxer's condition. Heart disease. Heart disease is another genetic health condition that boxers are prone to. The most common type of heart disease in boxers is called boxer cardiomyopathy. This condition affects the heart muscle, leading to an enlarged heart and potential heart failure. Some of the symptoms of heart disease in boxers include coughing, difficulty in breathing, fatigue, and fainting. If you notice any of these signs, it is important to seek veterinary care immediately. Treatment options for heart disease in boxers may include medications to manage symptoms and improve heart function, dietary changes to support heart health, and regular monitoring by a veterinarian. In some cases, surgical intervention may be necessary. Understanding and managing genetic health conditions in boxers is essential for ensuring their well-being. Regular veterinary checkups, a balanced diet, and appropriate exercise can help minimize the impact of these conditions and provide your boxer with a happy and healthy life. 2. Skin problems. Boxers are susceptible to various skin problems, including allergies, dermatitis, and infections. These skin issues can cause discomfort and affect the overall well-being of your boxer. It is important to understand the common skin problems faced by boxer dogs, their symptoms, and how to effectively manage and treat them. Allergies. Allergies are a common skin problem in boxers. They can be caused by various allergens, such as pollen, dust mites, or certain foods. Allergic reactions in boxers often manifest as skin irritation, itching, and hair loss. To identify allergic reactions, look out for symptoms like redness, swelling, and excessive scratching. It is crucial to manage and alleviate your boxer's discomfort by minimizing exposure to allergens and implementing appropriate treatment options. Dermatitis. Boxers may develop dermatitis, which is an inflammation of the skin. This condition can be triggered by environmental irritants, such as chemicals or parasites, or food allergies. There are different types of dermatitis, including contact dermatitis and atopic dermatitis. Symptoms may include redness, itching, and the formation of rashes or blisters. It is important to identify the underlying cause of dermatitis and seek appropriate treatment, which may include medication, topical creams, or dietary changes. Infections. Boxers are also prone to skin infections, such as bacterial or fungal infections. These infections can occur due to factors like poor hygiene, allergies, or injuries. Common signs of skin infections in boxers include redness, swelling, discharge, and a foul odor. Prompt veterinary attention and appropriate treatment, which may involve antibiotics or antifungal medications, are necessary to prevent the infection from spreading and to promote healing. To prevent and manage skin problems in boxer dogs, it is important to maintain good hygiene, regularly groom your boxer, and provide a balanced diet. Additionally, consult with your veterinarian for proper diagnosis, treatment, and preventive measures tailored to your boxer's specific needs. 21. Allergies. Boxers are prone to allergies, which can manifest as skin irritation, itching, and hair loss. These allergic reactions can be caused by various allergens that affect boxer dogs. It is important for owners to be able to identify these allergic reactions and take appropriate measures to manage and alleviate their boxer's discomfort. Common allergens that can affect boxer dogs include pollen, dust mites, mold spores, insect bites, certain foods. When a boxer is exposed to these allergens, they may experience symptoms such as redness, swelling, itching, and hair loss. It is crucial to closely observe your boxer for any signs of allergic reactions and seek veterinary advice if necessary. To manage and alleviate your boxer's discomfort caused by allergies, there are several methods you can try. Regular grooming and bathing to remove allergens from their coat. Using hypoallergenic shampoos and products. Keeping your home clean and free from dust and mold. Using air purifiers to reduce allergens in the environment. Identifying and avoiding specific allergens that trigger allergic reactions. Consulting with a veterinarian to explore potential allergy medications or treatments. By being proactive in managing your boxer's allergies, you can help them live a more comfortable and symptom-free life. 22. Dermatitis. Boxers may develop dermatitis, an inflammation of the skin, due to various factors such as environmental irritants or food allergies. Dermatitis can be classified into different types, including contact dermatitis, atopic dermatitis, and seborrheic dermatitis. Each type has its own set of symptoms and requires specific treatment approaches. Contact dermatitis occurs when the skin comes into direct contact with an irritant or allergen, such as certain plants, chemicals, or fabrics. Symptoms may include redness, itching, and the formation of blisters or rashes. It is important to identify and avoid the specific irritant or allergen to prevent further skin irritation. Topical treatments, such as corticosteroid creams or ointments, may be prescribed to alleviate symptoms and reduce inflammation. Atopic dermatitis is a chronic condition characterized by dry, itchy, and inflamed skin. It is often caused by a combination of genetic and environmental factors. Common triggers for atopic dermatitis in boxers include pollen, dust mites, and certain foods. Treatment may involve the use of antihistamines to relieve itching, moisturizers to hydrate the skin, and immunotherapy to desensitize the dog's immune system to specific allergens. Seborrheic dermatitis is a condition that affects the sebaceous glands of the skin, resulting in excessive oil production and flaky skin. It can be caused by factors such as hormonal imbalances, fungal infections, or underlying health conditions. Symptoms may include greasy or scaly patches of skin, redness, and itching. Treatment options for seborrheic dermatitis may include medicated shampoos, topical treatments, and dietary modifications. If your boxer develops dermatitis, it is important to consult with a veterinarian for an accurate diagnosis and appropriate treatment plan. They can help determine the underlying cause of the dermatitis and recommend the most effective treatment approach to alleviate your boxer's discomfort and promote skin healing. 3. Gastrointestinal issues. Boxers are known to have sensitive stomachs, which can make them more susceptible to gastrointestinal issues. 2 common problems that boxers may experience are gastric dilatation volvulus, GDV, and food allergies. Understanding the causes, symptoms, and management strategies for these conditions is crucial for maintaining your boxer's digestive health. Gastric dilatation volvulus, also known as bloat, is a serious and potentially life-threatening condition that commonly affects boxers. It occurs when the stomach fills with gas and twists, causing a blockage. This can lead to a range of symptoms such as restlessness, a distended abdomen, unproductive attempts to vomit, and difficulty breathing. Immediate veterinary attention is required if you suspect your boxer may be experiencing GDV. Food allergies are another gastrointestinal issue that boxers may face. These allergies can manifest as symptoms such as diarrhea, vomiting, and skin problems. Identifying the specific allergens causing the reaction can be challenging, but an elimination diet under the guidance of a veterinarian can help pinpoint the culprit. Once identified, eliminating the allergen from your boxer's diet is crucial to managing their digestive health. To ensure your boxer's digestive health, it is important to take preventive measures such as feeding them a balanced diet, avoiding sudden dietary changes, and providing regular exercise. Additionally, monitoring their behavior and seeking prompt veterinary care if you notice any changes in appetite, bowel movements, or overall well-being can help catch and manage gastrointestinal issues early on. 31. Gastric dilatation volvulus, GDV. GDV, also known as bloat, is a life-threatening condition that commonly affects boxers. It occurs when the stomach fills with gas and twists, leading to a dangerous buildup of pressure. This can be extremely painful for your boxer and requires immediate medical attention. There are several risk factors that can contribute to the development of GDV in boxers. These include the breed's deep chest and narrow waist, eating too quickly, exercising vigorously before or after a meal, and a family history of GDV. It's important to be aware of these factors and take preventive measures to reduce the risk. Recognizing the symptoms of GDV is crucial in order to seek help promptly. Some common signs of GDV in boxers include a distended or bloated abdomen, unproductive attempts to vomit, restlessness, excessive drooling, and difficulty breathing. If you notice any of these symptoms, it's important to act quickly. In case of a suspected GDV emergency, you should immediately contact your veterinarian or an emergency animal hospital. Time is of the essence when it comes to GDV, and delaying treatment can be fatal. While waiting for professional help, you can try to keep your boxer calm and comfortable by keeping them in a quiet and stress-free environment. It's important to note that attempting to relieve the gas by inducing vomiting or massaging the abdomen is not recommended, as it can worsen the condition. Only a veterinarian can properly diagnose and treat GDV. In some cases, emergency surgery may be necessary to untwist the stomach and relieve the pressure. This procedure is known as gastropexy and may also be performed preventively to reduce the risk of GDV in at-risk boxers. Prevention plays a crucial role in managing GDV. To reduce the risk, it's recommended to feed your boxer smaller, more frequent meals, avoid vigorous exercise before or after meals, and use specially designed slow-feed bowls to slow down eating. Regular checkups with your veterinarian can also help identify any potential issues early on. Remember, GDV is a serious condition that requires immediate attention. By being aware of the risk factors, recognizing the symptoms, and taking prompt action, you can help ensure the well-being of your boxer and potentially save their life. 32 Food allergies. Food allergies can have a significant impact on boxer dogs, leading to uncomfortable symptoms like diarrhea, vomiting, and skin issues. It is important to understand how to identify food allergies in your boxer and take appropriate measures to manage them. Identifying food allergies in boxer dogs can be challenging as the symptoms can vary. However, common signs include gastrointestinal issues such as diarrhea and vomiting, as well as skin problems like itching, redness, and hair loss. If you notice these symptoms in your boxer after consuming certain foods, it is a strong indication of a possible food allergy. To confirm the presence of food allergies, you can work with your veterinarian to implement an elimination diet. This involves removing potential allergens from your boxer's diet and gradually reintroducing them one at a time to identify the specific trigger. It is crucial to maintain a detailed food diary during this process to track any reactions or changes in symptoms. Once you have identified the specific allergen, the next step is to choose the right diet for your boxer. Your veterinarian can recommend hypoallergenic or limited ingredient diets that exclude the allergen. These specialized diets are formulated to provide all the necessary nutrients while minimizing the risk of triggering an allergic reaction. It is essential to strictly adhere to the recommended diet and avoid any exposure to the identified allergen. This may involve reading ingredient labels carefully and being cautious about treats or table scraps that could contain the allergen. By providing a suitable diet and minimizing exposure to allergens, you can effectively manage food allergies in your boxer and improve their overall well-being. 4. Cancer. Cancer is a significant concern for boxer dogs, with certain types being more prevalent in this breed. It is important for boxer owners to be aware of the common types of cancer that can affect their beloved pets. By understanding the symptoms, available treatment options, and strategies for early detection, you can take proactive steps to ensure the well-being of your boxer. There are several types of cancer that are commonly seen in boxers. One such type is mast cell tumors, which are one of the most prevalent forms of cancer in this breed. These tumors can appear as lumps or bumps on the skin and may vary in size and appearance. It is crucial to monitor your boxer for any unusual growths and seek veterinary attention if you notice any concerning changes. Lymphoma is another type of cancer that can affect boxers. This cancer affects the lymphatic system and can manifest in various ways, including swollen lymph nodes, weight loss, and lethargy. Early detection is key in improving the prognosis for boxers with lymphoma, so it is important to be vigilant and seek veterinary care if you notice any concerning symptoms. When it comes to cancer in boxers, early detection is crucial for successful treatment. Regular checkups with your veterinarian, along with routine screenings and diagnostic tests, can help identify any potential issues before they progress. Additionally, being aware of the common symptoms associated with cancer in boxers can help you take prompt action if any concerns arise. Treatment options for cancer in boxers may vary depending on the type and stage of the disease. Your veterinarian will work with you to develop a personalized treatment plan that may include surgery, chemotherapy, radiation therapy, or a combination of these approaches. The goal is to provide the best possible care for your boxer and improve their quality of life. In addition to treatment, there are strategies for early detection that can be implemented to catch cancer in its early stages. Regularly examining your boxer for any unusual lumps or bumps, monitoring their behavior and appetite, and promptly reporting any changes to your veterinarian can help ensure that any potential cancer is identified and addressed as early as possible. Remember, cancer is a significant concern for boxer dogs, but with awareness, early detection, and appropriate treatment, you can help your furry friend live a happy and healthy life. 41 Mast cell tumors. Mast cell tumors are one of the most common types of cancer that affect boxers. These tumors arise from mast cells, which are a type of white blood cell involved in the body's immune response. While any dog can develop mast cell tumors, boxers are particularly susceptible to this type of cancer. Signs of mast cell tumors in boxers can vary depending on the location and stage of the tumor. Common symptoms include the presence of a lump or mass under the skin, skin ulceration or inflammation, itching, and gastrointestinal issues such as vomiting or diarrhea. It is important to note that not all lumps or masses are cancerous, but it is always recommended to have any new growths checked by a veterinarian. Diagnosing mast cell tumors in boxers typically involves a combination of physical examination, fine needle aspiration, and biopsy. Your veterinarian may also recommend additional tests such as blood work, X-rays, or ultrasound to determine the extent of the disease and if it is spread to other parts of the body. Treatment options for mast cell tumors in boxers depend on various factors, including the tumor's grade, size, and location. Surgery is often the primary treatment approach, with the goal of removing the tumor and any surrounding tissue. In some cases, additional treatments such as radiation therapy or chemotherapy may be recommended to target any remaining cancer cells or prevent the spread of the disease. The prognosis for boxers diagnosed with mast cell tumors can vary depending on the tumor's characteristics and the stage at which it is detected. Early detection and prompt treatment can significantly improve the chances of a positive outcome. Regular checkups, monitoring for any new growths or changes in existing ones, and maintaining a healthy lifestyle can help reduce the risk of mast cell tumors in boxers. 42 Lymphoma. Lymphoma is a type of cancer that affects the lymphatic system and can also impact boxers. This disease occurs when there is an abnormal growth of lymphocytes, a type of white blood cell, in the lymph nodes. It is important for boxer owners to be aware of the symptoms, diagnostic approaches, treatment options, and prognosis associated with lymphoma in their beloved pets. The symptoms of lymphoma in boxers can vary, but common signs include enlarged lymph nodes, weight loss, decreased appetite, lethargy, and difficulty breathing. If you notice any of these symptoms in your boxer, it is crucial to seek veterinary attention promptly. To diagnose lymphoma, veterinarians may perform a physical examination, blood tests, and imaging studies such as X-rays or ultrasounds. However, the definitive diagnosis is typically made through a biopsy, which involves taking a small sample of tissue from the affected lymph node for examination under a microscope. Once a boxer is diagnosed with lymphoma, treatment options will depend on the stage of the disease and the overall health of the dog. Common treatment approaches include chemotherapy, radiation therapy, and immunotherapy. These treatments aim to slow the progression of the cancer, alleviate symptoms, and improve the quality of life for the boxer. The prognosis for boxers diagnosed with lymphoma can vary depending on several factors, including the stage of the disease, the response to treatment, and the overall health of the dog. While lymphoma is a serious condition, advancements in veterinary medicine have improved the outlook for affected boxers. With early detection and appropriate treatment, many boxers can enjoy a good quality of life for a significant period of time. In summary, lymphoma is a type of cancer that can affect boxers. Recognizing the symptoms, seeking prompt veterinary care, and exploring treatment options can help improve the prognosis and overall well-being of boxers diagnosed with lymphoma. It is important for boxer owners to stay vigilant and work closely with their veterinarian to provide the best possible care for their furry companions. 5 Joint and bone issues. Boxers are prone to joint and bone problems, including hip dysplasia and arthritis. These conditions can significantly impact your boxer's mobility and overall quality of life. Understanding the causes, symptoms, and management strategies for these issues is crucial in ensuring your boxer's well-being. Hip dysplasia. Hip dysplasia is a common orthopedic condition in boxers. It occurs when the hip joint doesn't develop properly, leading to instability and discomfort. The causes of hip dysplasia can be both genetic and environmental factors. Symptoms may include difficulty in getting up or lying down, limping, and decreased activity levels. To manage hip dysplasia in your boxer, there are several strategies you can consider. Weight management. Maintaining a healthy weight can help reduce the strain on the joints. Exercise moderation. Avoid high-impact activities that can worsen the condition. Opt for low-impact exercises such as swimming or controlled walks. Pain management. Consult with your veterinarian to discuss pain medication or supplements that can help alleviate discomfort. Surgical options. In severe cases, surgery may be recommended to improve the hip joint stability. Arthritis. Arthritis is another joint problem that can affect boxers, especially as they age or due to joint injuries. It causes inflammation and deterioration of the joint, leading to pain and stiffness. Common symptoms include difficulty in climbing stairs, reluctance to jump, and a decrease in overall activity level. To manage arthritis in your boxer, consider the following strategies. Weight management. Maintaining a healthy weight is crucial to reduce stress on the joints. Exercise. Regular, low-impact exercise can help improve joint mobility and strengthen the surrounding muscles. Medication and supplements. Your veterinarian may prescribe anti-inflammatory medication or recommend joint supplements to alleviate pain and inflammation. Physical therapy. Physical therapy techniques such as hydrotherapy or massage can provide relief and improve joint function. By understanding the causes, recognizing the symptoms, and implementing appropriate management strategies for joint and bone issues like hip dysplasia and arthritis, you can ensure your boxer maintains mobility and enjoys an improved quality of life. 51. Hip dysplasia. Hip dysplasia is a common orthopedic condition in boxers. It occurs when the hip joint doesn't develop properly, leading to abnormal hip socket and joint structure. This can result in pain, lameness, and difficulty in walking or running. The causes of hip dysplasia in boxers can be both genetic and environmental. Genetics play a significant role, as it is an inherited condition. Therefore, it is important to ensure that the parents of a boxer puppy have been screened for hip dysplasia. Environmental factors such as rapid growth, excessive exercise, and improper nutrition can also contribute to the development of hip dysplasia. Signs of hip dysplasia in boxers may include difficulty in rising or lying down, reluctance to jump or climb stairs, stiffness in the hind limbs, and a bunny hopping gait. If you notice any of these signs, it is crucial to consult a veterinarian for a proper diagnosis. Diagnostic methods for hip dysplasia in boxers typically involve a physical examination, X-rays, and sometimes additional imaging tests like CT scans or MRI. These tests help to evaluate the severity of the condition and determine the best course of treatment. Treatment options for hip dysplasia in boxers depend on the severity of the condition. In mild cases, conservative management may be recommended, which includes weight management, exercise modification, physical therapy, and the use of joint supplements or medications to manage pain and inflammation. In more severe cases, surgery may be necessary to improve the hip joint stability and function. It is important to note that while treatment can help alleviate the discomfort associated with hip dysplasia, it cannot cure the condition. However, with proper management and care, boxers with hip dysplasia can still lead happy and active lives. 52. Arthritis. Arthritis can develop in boxers as they age or due to joint injuries. It is a condition characterized by inflammation and stiffness in the joints, which can cause pain and discomfort for your furry friend. As a responsible boxer owner, it's important to understand the symptoms, treatment options, and lifestyle modifications that can help manage arthritis in boxer dogs and improve their joint health. Symptoms: limping or favoring certain limbs, stiffness, especially after rest, difficulty in getting up or lying down, reluctance to climb stairs or jump, swelling or heat in the joints. If you notice any of these symptoms in your boxer, it's important to consult with your veterinarian for a proper diagnosis and treatment plan. Treatment options. The treatment of arthritis in boxer dogs may vary depending on the severity of the condition. Your veterinarian may recommend a combination of the following: nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce pain and inflammation. Joint supplements such as glucosamine and chondroitin to support joint health. Physical therapy and exercises to improve mobility and strengthen muscles. Weight management to reduce stress on the joints. Alternative therapies like acupuncture or laser therapy. Lifestyle modifications. Along with medical treatment, making certain lifestyle modifications can greatly benefit boxers with arthritis. Provide a comfortable and supportive bed for your boxer to rest. Use ramps or stairs to help your boxer access elevated surfaces. Avoid activities that put excessive strain on the joints, such as jumping or running on hard surfaces. Ensure regular, gentle exercise to maintain muscle strength and joint flexibility. Implement a balanced diet that supports joint health. Remember, early detection and proactive management of arthritis can significantly improve your boxer's quality of life. Regular checkups with your veterinarian and open communication about your boxer's symptoms and progress are essential for effective arthritis management. 6. Eye problems. Boxers are prone to certain eye conditions that can impact their visual health. 2 common eye problems in boxers are corneal ulcers and progressive retinal atrophy. It is important for boxer owners to be aware of the signs, treatment options, and preventive measures for these conditions to ensure their boxers' eyes stay healthy. Corneal ulcers can occur in boxers due to various factors, including trauma or infection. These ulcers are open sores on the cornea, the clear outer layer of the eye. Signs of corneal ulcers may include redness, excessive tearing, squinting, and sensitivity to light. If you notice any of these signs, it is important to seek veterinary care promptly. Treatment for corneal ulcers may involve medication to promote healing and prevent infection, as well as protective measures such as an Elizabethan collar to prevent further damage. Progressive retinal atrophy, PRA, is a degenerative eye disease that can lead to blindness in boxers. It is an inherited condition that causes the gradual deterioration of the retina, the part of the eye responsible for vision. Early signs of PRA may include night blindness and difficulty seeing in dim light. As the disease progresses, boxers may experience a gradual loss of vision. Unfortunately, there is no cure for PRA, but there are management strategies that can help slow down its progression and improve the quality of life for affected boxers. Regular eye examinations by a veterinary ophthalmologist can help monitor the progression of the disease and guide treatment options. To prevent eye problems in boxers, it is important to take preventive measures. Regular eye examinations by a veterinarian can help detect any early signs of eye conditions and allow for timely intervention. Additionally, maintaining good overall health through a balanced diet, regular exercise, and proper grooming can contribute to the well-being of your boxer's eyes. It is also important to protect your boxer's eyes from potential hazards, such as sharp objects or chemicals, especially during outdoor activities or when engaging in rough play. In conclusion, being aware of the signs, treatment options, and preventive measures for eye problems in boxers is crucial for ensuring their visual health. By staying vigilant and seeking prompt veterinary care when needed, boxer owners can help their beloved pets maintain good eye health and enjoy a high quality of life. 61 corneal ulcers. 61 corneal ulcers. Corneal ulcers can be a common problem in boxer dogs and can occur due to various factors, such as trauma or infection. It is important for boxer owners to be aware of the symptoms, diagnosis methods, and treatment approaches for corneal ulcers to ensure the well-being of their furry friends. Symptoms: eye redness and inflammation, excessive tearing or discharge, squinting or rubbing of the eye, cloudiness or opacity of the cornea, visible ulcer or sore on the cornea. If you notice any of these symptoms in your boxer, it is crucial to seek veterinary attention promptly. Diagnosis methods. When diagnosing corneal ulcers in boxer dogs, a veterinarian will typically perform a thorough eye examination, including visual inspection of the eye, fluorescein staining to highlight any corneal abnormalities, measurement of tear production. These diagnostic methods help determine the presence and severity of corneal ulcers. Treatment approaches. The treatment of corneal ulcers in boxer dogs may vary depending on the underlying cause and the severity of the ulcer. Common treatment approaches include topical antibiotic or antifungal eye drops to prevent infection, anti-inflammatory eye drops to reduce inflammation and pain, protective contact lenses or eye patches to promote healing, oral medications to address any underlying conditions or infections. In severe cases, surgery may be required to repair or graft the damaged cornea. It is important to follow the veterinarian's instructions regarding medication administration, eye care, and follow-up appointments to ensure a successful recovery for your boxer. 62. Progressive retinal atrophy. Progressive retinal atrophy, PRA, is a degenerative eye disease that can have a devastating impact on the vision of boxer dogs. It is characterized by the gradual deterioration of the retina, eventually leading to blindness. Understanding the signs, genetic factors, and available management strategies for this condition is crucial in preserving your boxer's vision. PRA is a hereditary condition that is passed down through genes. It is important to note that not all boxers will develop PRA, but certain genetic factors can increase the risk. Responsible breeding practices and genetic testing can help identify carriers of the PRA gene, reducing the chances of passing it on to future generations. Signs of PRA may vary, but common symptoms include night blindness, dilated pupils, and a decline in visual acuity. As the disease progresses, affected boxers may start bumping into objects, become hesitant in unfamiliar environments, and experience a general decline in their ability to navigate their surroundings. While there is currently no cure for PRA, there are management strategies that can help slow down the progression of the disease and improve your boxer's quality of life. Regular visits to a veterinary ophthalmologist are essential for monitoring the condition and implementing appropriate interventions. One management approach is the use of antioxidants, such as vitamin E and omega-3 fatty acids, which have shown some promise in slowing down the degeneration of the retina. These supplements can be incorporated into your boxer's diet under the guidance of a veterinarian. Additionally, environmental modifications can help your boxer navigate their surroundings more easily. Keeping furniture and objects in familiar places, providing consistent routines, and using verbal cues can all assist your visually impaired boxer in adapting to their changing vision. Regular eye examinations and early detection of PRA are crucial for implementing management strategies promptly. If you notice any changes in your boxer's vision or suspect they may be developing PRA, it is important to consult with a veterinary professional for a comprehensive evaluation and guidance on the best course of action. 7. Dental issues. Boxers are prone to dental problems, including periodontal disease and tooth decay. These oral health issues can cause discomfort and pain for your furry friend, affecting their overall well-being. Therefore, it is crucial to prioritize dental care for boxer dogs to ensure their oral hygiene and prevent potential complications. Regular dental checkups and cleanings are essential to maintain your boxer's oral health. During these visits, a veterinarian will examine your dog's teeth and gums, looking for any signs of dental problems. They may also perform a professional cleaning to remove tartar and plaque buildup, which can contribute to periodontal disease. In addition to professional dental care, there are preventive measures you can take at home to promote good oral hygiene for your boxer. Brushing your dog's teeth regularly with a canine toothbrush and toothpaste specifically formulated for dogs is highly recommended. This helps remove food proteins and bacteria, reducing the risk of plaque formation and gum disease. Furthermore, providing your boxer with dental chews or toys designed to promote dental health can also be beneficial. These products help remove plaque and tartar buildup while keeping your dog entertained. Just make sure to choose dental chews that are appropriate for your boxer's size and chewing habits. It's important to note that while preventive measures are crucial, dental issues can still arise despite your best efforts. If you notice any signs of dental problems in your boxer, such as bad breath, swollen gums, or difficulty eating, it's essential to consult with a veterinarian promptly. Early detection and treatment can help prevent further complications and ensure your boxer's oral health. In conclusion, dental care plays a vital role in maintaining the overall health and well-being of boxer dogs. By prioritizing regular dental checkups, practicing good oral hygiene at home, and being attentive to any signs of dental problems, you can help keep your boxer's teeth and gums healthy for a lifetime of smiles.